I'm Dr. Rachel Scott. I'm a plastic and reconstructive surgeon here at Hendricks Regional Health. So I'm board certified in both plastic surgery as well as general surgery. And particularly for plastic surgery, board certification is a really important distinction. Board certification means that you've undergone a very rigorous training program as well as rigorous examination by other qualified individuals that says that you know what you're doing. I grew up just one county over in Putnam County, so Hendricks has been our home hospital for essentially my whole life. And as I was going through my training process, I had an inkling that I did not want to be at a big academic type center or in a major metropolis. And the thought came back to Hendricks. I think Hendricks has grown and developed in huge ways over the last several years, and I saw that as an opportunity for me to contribute to my community and make use of the skills that I've learned. Plastic surgery is a very wide spectrum of practice. We literally operate on everything from the very top of the head to the bottom of the foot and everywhere in between. So not every plastic surgeon, of course, does every procedure, but we're all trained in both cosmetic procedures, which is what people generally think of, as well as a wide variety of reconstructive procedures, including wound reconstruction, breast reconstruction, burn reconstruction. And the one thing that I think a lot of people are unaware of is that we also treat a lot of hand injuries and we have a lot of hand surgery training. Insurance would not cover something that is strictly cosmetic, so that is strictly being done just because the patient wants to have it done. But there are a lot of things that may lie on the borderline, things like breast reduction, things like some scar revisions, which may in some cases be paid for by the insurance companies. Another area which people may be unaware of is that we have lots of patients who have had bariatric surgery or who have experienced massive weight loss through their own hard work and effort. And for those patients, they are oftentimes left with a lot of hanging skin and a lot of changes to the shape of their body, which can be really frustrating after they've made such huge leaps in other ways. They can sometimes think that they're just stuck with it unless they want to fork out a lot of money to have contouring surgery, but oftentimes that's not the case. Those things too may be covered by insurance. So probably about 70% of my patients are women. And we had a very interesting opportunity here at Hendricks when we had the breast oncology surgeons join. There was already a very well-established radiology section for doing mammography and other breast imaging. But when I arrived and the breast surgeons arrived, we decided, well, let's combine forces both from a strategy standpoint as well as just geography. And Hendricks was able to remodel this space and give us a physical continuity of care from the radiology to the breast surgeons to my plastic surgery office, so that patients that are needing those services can literally walk down the hallway. So consultations are a situation in plastic surgery where it's always better to get more information and to ask the question. If you just make assumptions and you never take the leap, you'll never know the answer. So if someone has a question about whether they're appropriate for a plastic surgery procedure or whether it's something that their insurance might cover, should never hesitate to call and ask or call and schedule a consultation visit. I think that whether it's someone that I released their carpal tunnel, someone that I reconstructed their breasts, or someone that I did a tummy tuck for, every one of those patients, my goal is to bring a smile to their face and make them feel like their life is better having had the surgery that I provided to them.